Good afternoon, distinguished leaders and colleagues. It's an honor to speak to you today as a Marmara Foundation member and its United States representative. Before I begin, let me introduce myself. My name is Kemal Erkan, and I'm the CEO of United Medical, based in the United States. United Medical is an accountable care organization and population health management company. Focuses on integrates healthcare services across clinical, operational, and financial domains. We support physicians, healthcare facilities, and patients by using technology provided by Oracle and Oracle Health, and centralized services to improve outcomes, reduce costs, streamline care delivery. With over 2 decades of experience in healthcare transformation, I have seen firsthand how sustainability must be built into the foundation of care. Before we go into the topic itself, I just use this analogy, and I think it's important. You probably heard this from so many different places, so many different people. You cannot fix new problems with old tools. Now, I have a really good example of this. And I'm sure you are going to remember this in the future, and you'll probably tell your friends. So once in the old days, folks were mastered at cutting ice. This is in 1920s, 1930s. But once the refrigerators came along, all the effort became obsolete. Today, no matter how skilled you are in ice cutting, it doesn't matter because the game has changed. And in our world, the same thing applies. To stay ahead, we need tools and strategies fit for future and now, not stuck in the past. Sustainable healthcare is no longer an optional. It's strategic imperative. This is about readiness for future that has already arrived. One where our systems must evolve, otherwise the risk of collapsing is there. Life expectancy has risen dramatically. This is a remarkable achievement, but our systems were built for a different time. Today, people live into their 80s or beyond. Yet we still manage illnesses reactively, not proactively. This leads to a skyrocketing cost, caregiver burdens, and gap in long-term health. We must ensure that longer life comes with quality of life, supported by a system that's sustainable and prepared. We face growing chronic diseases, risk mental health needs, climate-driven health emergencies, and workforce burnout. Healthcare inequality deepens, and the economic strain is unsustainable. If our system fails, our societies become fragile. Sustainable healthcare is not a policy detail, it's a foundation for resilience. So what does this sustainability look like? So the prevention first, with education, screening, and nutrition, smart use of AI and telehealth, improving access to outcomes, value-based care, rewarding results, not volume, climate-conscious infrastructure, efficient and resilient, and human-centered design, addressing social factors and ensuring equity. This is also known as social determinant of health. This is already happening in some regions. Now we need global leaders to scale this. We must also prioritize women's health. Maternal mortality remains high in many areas, and access to reproductive, prenatal, and postpartum care is inconsistent. Sustainable system must guarantee safe, equitable care for women. This is not a health issue, but it's a human right problem, and generational investment is needed. For leaders, this is more about healthcare, more than just about healthcare. I'm sure you guys heard Dr. Aziz Sancar earlier this morning, his concerns about the global issues. When you look at from the healthcare standpoint, everything that he has said is also happening in the healthcare side. And unless you have a good, strong healthcare system, countries, populations, they have zero chance to survive in the future, because this is a natural security relies on resilient systems. Economies depend on healthy, productive populations. Public trust is shaped by access and fairness. The nation that leads into sustainability will lead the global future. We cannot delay this. So we must commit not to reactive care, but long-term health resilience. We must invest in prevention, in system, in innovation. We must lead together across borders as the future demands of us. Sustainable healthcare is our shared responsibility and our strategic opportunity. Thank you.
Çok teşekkür ediyorum Kemal Bey. Oradan ayrılmıyorsunuz.